Hello everyone, I am Dr. Manju Dagar, Senior IVF Specialist at Nestlings Gynecology and Fertility Center. Today we will discuss about whether the IVF is painful or not. Many patients in our clinic comes and ask, Doctor, is IVF is a very painful procedure? My standard to all is, IVF is more mental than physical. It is mentally painful rather than physically. So to understand where this pain come from, we need to understand what is the IVF. So we complete the IVF process in 4 steps. The first step is we make egg, and during making of the egg, we give hormonal injection to the patient. And these injections are so fine in the form of pen or in the form of fine needle. These are like insulin injections. These injection patient can take on her own. So diabetic patient can take injection 3 times a day whole life. These are very fine injection and there is no pain at all in these injection. So this is the first step. Second step is the step of egg retrieval. When the eggs are formed, we take out the egg, all egg outside the body, and we form the embryo inside the lab. During this egg retrieval, we give anesthesia to the patient and there is no cut, no stitch to the patient. In this case, we do egg retrieval under ultrasound guidance and under anesthesia. So this process is also not at all painful. We keep the patient at our hospital for 4 to 5 hours and then we send back. And patient can resume their activity on the same day. Third step is embryo transfer. So embryo transfer is a very simple process. In this case is like a normal gynecological examination, like pap smear examination. Patient need to fill the bladder and come with after the meal, and we do embryo transfer with full bladder under ultrasound guidance. This is a very simple process and there is no need of anesthesia and it is not at all painful. These are the steps in IVF. So we have seen that nothing is painful during this. Then what is painful? Painful is whether to take injection is painful, no. To egg retrieval is no. Embryo transfer is painful, no. So painful is waiting outside the doctor's cabin for the consultation, for the injections, for the ultrasound, to come back daily and to take the advices, to get a scan done, to get ultrasound done. And finally, you have gone through all these steps. And finally, one step is painful, that is the result of IVF. The IVF is painful when results came negative. When result comes negative, then patient become very disturbed and then it is painful. Then he or she and the couple thought that we have gone through all this process and still it is not workable. So the pain is more emotional and psychological rather than physical. So in this case, just I have to guide my patient emotionally and psychologically. Sometime the success may not be at the first step, but it can come in the second and third step, and at last many of the patient will conceive. But finally success will come to everyone. So all you need is that a bit of hope and a bit of faith is required in IVF. A patience is required in IVF, and you need to be hopeful because hope sustains life. Thanks.